right, it looks like we're ready. Jeannie, you want to get started?
Sure. Hi, everybody. Thanks for coming to our webinar tonight, or whatever time it may be where you are. We hope we have participation throughout the country and anywhere around the world. It's open to anyone. We are excited to have Ashley Williams here, who is a licensed clinical social worker and also a desmoid tumor patient who is in active treatment, actively dealing with the disease, and all of the coping skills and mental health challenges that we have in this journey. I'm Jeannie Whiting. I'm co-founder and executive director of the Desmoid Tumor Research Foundation. We were just commenting among ourselves that we're so excited about this series on mental health tools, because we've never done anything as comprehensive as this before. And we've had tremendous feedback about how meaningful it is to the patients. So we hope that you find something, some new tools, some new coping skills, some new ideas that will give you peace and help in your journey with your desmoid tumor. And be aware that this will be recorded and be made available on our website. So if you want to listen again, you'll be able to do that. I'll turn the time now over to our Director of Operations, Lynn Hernandez, who will introduce our speaker. Lynn?
All right, great. Thanks so much, Jeannie. So I would like to introduce our presenter this evening. You probably recognize this name and this face since this is a series. So Ashley Williams is a licensed clinical social worker and trauma counselor from South Florida. Back in 2015, she was diagnosed with a desmoid tumor in her left leg. Since then, she's become passionate about helping patients heal from the trauma of their diagnosis and treatment. Her focus is on those with desmoids, cancer, chronic illness, and other rare diseases. Having undergone multiple rounds of treatment herself, Ashley believes in a holistic mind and body approach. She continues to help individuals from these communities work through their trauma in her counseling practice. Welcome, Ashley. So before we get started, I have a few instructions for our attendees. We welcome questions via the Q&A. You'll see the Q&A icon at the bottom of your screen. So if you have a question for Ashley, please share it there, and she will try to get to it at the end of her presentation. Also, you'll see that there's a chat function open for your use to communicate with the community. Again, there's a little chat button below. If you click on that and you would like to share something with the community, please do. This is unmonitored, the chat, so please don't post any questions for us in there. But we would love to have you share with the community. So now I will hand things over to Ashley.
Thank you so much, Lynn and Jeannie. It is so nice to be back. I love any time that I have the opportunity to meet with the desmoid community and just talk about topics that I know so well. As Jeannie shared, I am currently waiting for results on my last round of active treatment. So I know what it is to be going through this diagnosis in the process, but have also worked for quite a bit of time in the realm of trauma and trauma treatment and mental health. And so for today, our topic is going to be on one of my favorite things. It's going to be on self-care. I think that you can see my screen, so we're just going to move ahead. With self-care, this is something that is so, thank you very much, Lynn. This is something that's so important for us to talk about as desmoid tumor patients, because our experience tends to be for the long haul. And so how do we really take care of ourselves throughout courses of treatment, but also after treatment is over and whenever we're in a survivorship and recovery phase? As I've mentioned before, I'm a licensed clinical social worker and a certified clinical trauma professional. All of the information that I'm sharing with you today is intended to be informational and educational, but it's important to run it by your medical professionals and your own mental health professionals who are with you on this journey to see if some of the techniques and the strategies that we talk about are going to work specifically for you. Because even though I'm a mental health professional, I am not your mental health professional, so I don't know all of the details to your case, but I'm hoping that some of these self-care strategies will be very beneficial and things that will help in really just bringing peace, calm, lower anxiety to the Desmoid process. So let's get started. I'm sure many of you have talked about self-care before. I'm sure many of you have seen images like this before when talking about self-care, but I do think it's really important to preface the topic of self-care with an understanding of why it's so important. As a Desmoid patient, self-care can realistically kind of be pushed to the side because in reality, our diagnosis, our treatment, our medical needs can be very time consuming, and they can take up a lot of time and energy in our lives, away from work, away from our family. And so often we tend to, like, self-care is the first thing that's eliminated because the thought is, I already spend so much time on me. I already spend so much time on my medical experience, my medical journey. And so when I'm not dealing with my Desmoid, let me go ahead and actually be a participant in the lives of the people around me. And yes, that's very important, but it's also important not to neglect self-care because we feel like we're already so focused on ourselves with our diagnosis. And so today we're going to talk about some strategies of how can we focus on ourselves and our self-care, because as these images portray, it's important for us to be able to take care of ourselves first before we're able to really give back to anybody else. We've all been on a flight before where we've heard the stewardess or the steward tell us, if the oxygen masks come down, make sure you put yours on first before you put on somebody else's. Because if you put on somebody else's and you neglect taking care of yourself, that has the potential for really negative repercussions. The image of a teapot is also really significant. I like this one because if we look at ourselves as the teapot, we need to make sure that we're full of tea before we're able to pour it out and really give to other people. And so self-care is really about, how do I invest in myself? How do I pour into myself so that I can go out and continue being an active participant in my life and an active participant in the relationships in my life? So I want to dispel a couple of myths about self-care. And talk a little bit about what self-care is and what self-care isn't. So according to this definition, I'm sorry, my images are on this screen, so I'm looking to the side, but what self-care is, it says self-care is any activity that we do deliberately in order to take care of our mental, emotional, and physical health. So self-care is action-oriented, self-care is a choice, self-care is deliberate, something that we incorporate into our lives intentionally. There are some myths about what self-care is, so let me just kind of dispel those right off of the bat. The first one is that it's a one-size-fits-all type situation. Anytime we talk about self-care, it is inevitable that there is going to be something associated with like a bath or a spa, and those things can definitely be self-care. But I think culture has kind of given us this narrow view of what self-care is, and that it's more in line of like pampering ourselves and taking care of our physical body more than anything else. And so while this may be considered self-care for some people, there are so many different facets of self-care, and we're going to talk about a few of them today. Self-care isn't anything that soothes you. Often we look at it from the perspective of, I just want to feel better. And so anything that makes me feel better is going to be caring for myself. But if we look at that category of anything that soothes us, then we could be looking at alcohol. We could be looking at drugs. We could be looking at an excessive amount of anything that in moderation might be okay or might even be good for us, but in excess is not good for us. And so we're not looking for things that soothe us necessarily. we're looking for things that calm our nervous system, but not necessarily things that soothe the emotions that we're feeling or trying to numb the emotions that we're feeling. Self-care is not selfish or indulgent. I know this is a major struggle for a lot of people, and this can be a major struggle for me too, but self-care is not selfish. Of course, we can look at it that way because we're focusing on ourselves and we're focusing on the things that we need and how do I energize myself and fill myself up, but it's not selfish, it's not indulgent. It's actually a very, very necessary thing in order to avoid burnout, medical burnout, desmoid burnout, and really continue to be an active participant in our lives. Self-care, I had this impression of like, it takes a long time. Like I have to dedicate a whole day to going to the spa, or I have to dedicate an hour to taking a bath. And during busier seasons, I might completely neglect self-care because I just don't have the time to do it. But in reality, self-care can be standing up and taking a walk around the office during your workday, taking a 2-minute break, going to the kitchen and actually eating lunch or eating dinner at the time that you have allotted for you during your workday. They can be very simple, very time efficient things that we incorporate into our day and don't require this big like dedication of time on our calendar. Self-care is not always relaxing. And I think we have that idea too of it's something that's just going to be like tranquil and peace and calm. But in reality, self-care can be engaging in sports. Self-care can be engaging in friendly and boundaried debate with people. There are a lot of different facets of self-care. And so it's not always going to be something that's relaxing either. It's going to be something that's energizing. And sometimes the things that energize us are exhausting too. And so it's really finding the balance between those things, but it's not necessarily just looking for ways to relax. That's a part of it, but not the complete picture. And finally, self-care shouldn't be used as a reward. I have heard so many times, I've done this myself, where I'll tell myself, you know what, I exercised today, so I deserve that cookie or I deserve that dessert. And because I did something else, that means now I can reward myself with self-care. And it's something that I give back to myself only when I've accomplished a goal or I've achieved something. I want to take that mindset and that perspective off the table because self-care is not a reward for doing something or achieving something. Self-care is a necessity in order to make it through this journey without feeling burnt out. And again, with being able to really engage and invest in our lives in a meaningful way. So there are many different realms of self-care. Today, we're going to be talking about some of the most basic. And so we're going to be looking a little bit deeper into what does it mean to care for yourself physically, emotionally, spiritually, socially, intellectually, and self-care from a sensory perspective. There are more topics and more realms that we can add here, but these are the ones we're going to focus on for this evening. I'm going to pause here just for a minute because I'd like everyone who has joined us, if possible, to grab a piece of paper, grab a pen, grab a journal, something to write with, something to jot down. Because when we talk about self-care, it's great if we come up with like different topics and different strategies to talk about, but self-care requires action. And so I want to make sure that everybody who's joining us leaves tonight with a self-care plan, an action that is pertinent to you or things that you would like to try to incorporate into your self-care routine and the intentionality of bringing this into your daily life. And so again, we're going to be talking about these 6 topics. You can put it across the top of the paper. And then if there's something or a strategy that we talk about that you think like, oh, okay, I could try that, or that might work for me, I want you to jot it down. If you think of something specific or something that we talk about jogs your memory, and it's not even necessarily something that we are explicitly talking about, I want you to write it down so that by the end of our session and our time today, we can all walk away with a plan and some action steps for how And in what ways can we really begin to incorporate this into our life? Okay, so the first one that we're going to talk about is physical self-care. And I just want to preface that over the last 3 dealing with Desmoid sessions, we have talked through a lot of strategies for physical self-care. And so I'm going to touch on some of them tonight, but a lot of them are described much more in depth in previous sessions. In our previous sessions, we've talked about dealing with trauma triggers, dealing with grief, anxiety, fear, loneliness, just all of these emotions that can come up. And in our first session, and really the ones to follow, we've talked about how trauma affects and lives in our bodies. And so whenever we experience something like our desmoid diagnosis, or we experience treatment that is scary and that is hard, our body reacts in a way of trying to protect ourselves. Our body jumps into that fight or flight mode in an effort to protect ourselves. And we've talked before about how it's very important, once our body has kicked into that mode, to do practices or to engage in things that remind us that our body is safe, or that we're in a safe place if we are. And how do we bring our nervous system, the one that's responsible for relaxing and for digesting and for resting, how do we bring that aspect of our nervous system back online? And so when we talk about physical self-care, we're really going back to those principles of how do I override my fight or flight nervous system that's creating anxiety, that's creating hypervigilance, which means I'm just like very aware of all of the potential threats in my surroundings. How do I kind of bring that back online so that I can bring rest to my nervous system? I haven't talked about this word before, but this word is essentially the definition for a lot of the strategies that we've talked about in the last couple of sessions. It's called interoception. And what that is it's the ability to sense what is happening in our body. Whenever we go through something challenging, whenever we experience a trauma, whenever we are maybe not trying to feel what's going on in our bodies because it's painful, or because we're nauseous, or because we're sick, or because we're affected by our treatments, our body's natural reaction to protect us is to kind of disconnect our brain and our body so that we start to live inside of our heads, but we try to quiet the sensations and the feelings that are going on in our body. We live in a culture and a society that really believes in mind over matter. And so it is imperative for us to master our bodies by mastering our intellect and our brain function. And when our bodies are telling us, hey, you need to slow down, you need to rest, often we can be praised for pushing our bodies past the point of what it's asking us to do. If it's asking us to rest, pushing ourselves past that and not allowing our bodies to slow us down, so to speak. And so when that happens, one of the most important things for us to do in regards to physical self-care and calming the nervous system is, how do I bring my awareness back to what's going on inside of my body? How do I know what's happening here? That can be a really scary prospect, but we've talked through a lot of strategies, like you can see in the calming the nervous system section, of things like breathing. If I'm focusing on my breath, if I'm focusing on my in-breath, if I'm feeling kind of the cool air against my nostrils as I'm expanding my lungs, then this is a sensation that's taking place in my body that I'm bringing my awareness to, actively helping to heal that disconnection that's going on between my brain and body. Last time in the anxiety session, we talked about something called body scans, which is a form, progressive muscle relaxation is a form of body scan, which is essentially, let me take a moment, let me take 5 minutes and really bring my awareness and my attention to, how are my feet feeling right now? Like, what sensations are going on in my feet? And let me like sit there for a moment with my awareness on how my feet are feeling. And then I can bring my awareness up to my legs, then maybe my hips. And I'm really taking in, what is my body telling me and what are the sensations in my body at the moment. Grounding, we've talked about a technique called 5-4-3-2-1, which is whenever I am so out of touch with my body and I'm operating just in my brain space, how do I bring myself back to the present moment? I don't know about you, but whenever it comes to diagnosis and treatment, oftentimes I find that my thoughts either take me to the past of everything that I've been through, all of the challenges I've had to walk through, or it can bring me to the future of really wondering what's going to happen next. How is this treatment going to work? What are my results going to be? And that can be very dysregulating for our nervous system if we are focused on the future or on the past. And so the grounding techniques really bring you back to the present moment. Earthing is another form of grounding. And so that's essentially having your body in touch with nature. It's like sitting outside with your feet in the grass or your feet in the sand. And science actually tells us that whenever your feet are in touch with a natural surface, there's an exchange of electrons that actually help to calm your nervous system. And so being outside, being in nature, really engaging with the elements of nature is really significant for calming your nervous system. And laughing and lightheartedness is really important as well. So when we talk about physical self-care, some of the practices might seem a little vague, but also there's very tangible practices for how do we do interoception? How do we raise awareness to what's going on inside of our body? And that's really drawing our attention to my breath, drawing my attention to sensations that I'm feeling, drawing attention to my sensory experience as it interacts with nature or as it interacts with something else. I want to talk for a minute about sleep hygiene. It is so important whenever we're talking about physical self-care because sleep is something that is really difficult. It can be really difficult, especially if you're on treatment or if you're in pain. And so there are some strategies, some evidence-based strategies for tips that help us whenever we are trying to get the 7 to 9 hours of sleep a night that were recommended. So the first is checking your environment. Sleeping in a colder environment that is completely dark is what's recommended and suggested. Using your bed only for sleep is very active in the science of sleep hygiene. And so we tend to use our beds to watch TV or to just hang out sometimes, or that's where we read a book, or that's where we do something else. But if you're struggling to sleep, the recommendation is only using your bed for sleeping in the attempt to sleep, because then there's a connection in your brain that's actually made that this is where I sleep. Avoiding napping because it can mess with the rhythm of your sleep. Avoiding alcohol, caffeine, and nicotine. These are all things that turn your nervous system on. And so if your nervous system is turned on, if your body's developing cortisol and adrenaline, then those are going to keep you up and keep you from getting a good night's sleep. This one was a game changer for me. And so I'm excited to share it because I didn't know it before I learned it, but don't force yourself to go to sleep. If you are trying to go to sleep and you find that you're unable to, the science says give yourself 15 minutes to try to fall asleep. If you're not asleep within 15 minutes, it's best for you to get up and perform a task. Now, it's recommended that we keep a list of very small tasks. On a pad by your bed or somewhere where you can access it. Something like unloading the dishwasher, something like folding laundry, something that's time limited that you can dedicate 15, 20 minutes to complete the task and then go back to bed and try again. But if we're having difficulty sleeping, staying in our beds gives our brain the signal that, okay, this isn't necessarily equated with sleep. And so if I get up for periods of time and I try to finish a task, then I come back and try to sleep, that's actually an evidence-based practice for helping to get to sleep whenever you're struggling to. avoiding blue light like your phone or your computer or your TV an hour before bed, and following a sleep schedule. And so going to bed and planning to go to bed at the same time every night. Sleep is very important, especially for those who are on active treatment. And I know you might be thinking, some of you might like sleep a lot and some of you might not sleep very much, but especially being on active treatment, sleep is the time whenever our body switches into that rest and digest mode. And so that's the time when our body's really given an opportunity and a chance to recover from everything that it's endured during the day. The last ones I'll go through quickly because we've heard them before. We're all involved in the medical space. And so hydration is very important for physical self-care, nutrition. And I want to kind of separate hydration and nutrition a little bit from like maintaining your weight or maintaining your appearance. I think whenever we talk about things like hydration and nutrition, it's normally in the realm of dieting or being a certain weight for health reasons. But I'm looking at it more from, I'm not taking care of my body because my body is how I appear to the world. I'm taking care of my body because it's my home. And how do I create an environment for my body that my nervous system can feel safe and my nervous system can feel calm. And so eating a well-balanced diet is going to be different for everybody. For me specifically, I know food sensitivities play really heavily into what does that look like. And so certain foods might activate your nervous system where they don't activate mine or vice versa. And so being aware of these things can be really powerful in deactivating your nervous system. Intuitive eating is a form of interoception. So that word of like, how do I get in touch with what's going on inside of my body? Intuitive eating is how do I develop awareness towards hunger cues? Like, how do I know when I'm hungry or how do I know when I'm full? And so if interoception feels like a little bit of a vague concept, intuitive eating can be a really powerful way to kind of jump into it, because we're trying to listen to our body to give us cues for when we're hungry or when we're full. And so if we do that, that's a great way to start learning how to respond and react and listen to our body's cues. Now, I know it's not that easy for everyone. Some of you who are on active treatment, eating might be like impossible or feel impossible. And so rather than intuitive eating, if I'm doing that and I'm on treatment and I have no appetite, then how am I supposed to do that? Well, that's where I really encourage you to touch base with your healthcare professional, because there are different strategies for ensuring that you're getting enough food, because that's also obviously really important in your physical health. Keeping routines, so keeping your medical routines and keeping a plan throughout the day is really valuable for physical self-care. And then finally, movement. We learn, and the research is telling us, that the entire purpose of our brain is to produce movement, and that movement is really the only way that we interact with the world. And so again, when we talk about movement, we tend to think about it in terms of exercise and exercise only, but I'm not talking about exercise necessarily. Can exercise be a form of movement? 100%. But when I talk about movement, I'm also talking about things like I'm going to dance around the kitchen while I'm cooking dinner, or I'm going to do stretches in my room because that's what feels good to my body. I'm going to stand up during my work day and I'm going to take a walk around the office every hour, and I'm going to take laps just to get my body moving. It can be very small things. I remember when I was on treatment, when I was on chemo, there were days that I felt so sick, and my objective was, I'm going to get up out of this bed, I'm going to go downstairs, I'm going to get myself a cup of water, and that's going to be like my big outing for the day. And so even something like that, it doesn't have to be a commitment like running a mile every day. It could be something very, very small. The next area we're going to talk about is emotional self-care. And the first thing that comes to mind is self-compassion. With our diagnosis, I think being kind to ourselves can sometimes be really challenging, because for many, I know I've spoken to many people who share the sentiment of like, my body has betrayed me. And so how do I be kind to myself, and how do I be kind to my body? We tend to beat ourselves up and be really self-critical whenever we don't have the energy we think that we should, or we aren't able to engage in the same things that we used to. I currently have a disability, so my desmoid is in my leg, and I am unable to walk very easily. It's pretty challenging. And so I just came back from a trip where I was flying by myself and I had to walk through the airport. And man, I caught myself being so critical, like, this used to be so easy for you before, Ashley. You could do this so easily. Now this has become so hard. This is so taxing for you. And really having to make that active choice to shift our mindset to be compassionate towards ourselves. Self-compassion is characterized by 3 different things. And the first one is self-kindness. Self-kindness can be kind of hard. And so I always encourage people to talk to yourself the way that you would talk to one of your closest friends. The way that we talk to ourselves, we would probably never talk to one of our close friends that way. And so trying to reframe our perspective a little bit and view ourselves as a close friend and talk to ourselves that way. The second thing is called shared humanity. And that's essentially like, we're all human. We all make mistakes. We all have good days. We all have bad days. And that goes for me, that goes for you. And so giving myself the permission to be a part of humanity and to share that with all of you, and to not beat myself up for those days that are a little bit more challenging, or I make mistakes or have a failure of some sort, really understanding that that's part of being human. And the third thing is mindfulness. And mindfulness is essentially, how do I observe my thoughts in a way that's not judgmental? How do I just allow the feelings and the thoughts that come up to be present, but not judge them or criticize myself for having them? The second thing is self-permission. Now, self-permission is also a big deal, because whenever it comes to emotions, many of us have learned in our family or in our culture that certain emotions are not okay. And that if you feel a certain way, you should probably quiet that emotion and make sure that nobody else sees it, because we don't want to be a burden. We don't want anybody to see like our cards. We don't want anybody to see us sad. And so we learn to kind of quiet those things, and we learn that certain emotions are uncomfortable and we label them as being bad. And so we try to make sure that there's no space for those emotions to exist within us. And so self-permission is really, I'm going to give myself permission to feel the emotions that are coming up, because you know what, having a desmoid is hard. And so I'm going to allow myself to just sit with the grief of it, sit with the sadness, sit with the anxiety, or sit with any of the other emotions that come up. And I'm going to give them space to exist without trying to quiet them or push them aside. The third thing is self-curiosity. And I love this quote. It says, once you start approaching your body with curiosity rather than fear, everything shifts. And I put this in the emotional self-care section because I'm really talking about it from the perspective of emotions. Whenever we experience emotion, and I'm a prime offender. There are many times, especially when it comes to my medical journey, when I beat myself up because I tell myself, you should be stronger. You should be able to handle that. This shouldn't affect you. This has happened before. Why are you crying? Like, you know what's happening right now. And so rather than beating myself up for having those emotions come up, let me take a stance of curiosity. Let me look at the emotions and ask myself, why are these here? Let me notice the course that it decides to run, and let me, again, allow space for it versus trying to criticize it out of me or trying to kind of shut it out of me. Self-trust is also very important, and can be very hard for us, because self-trust goes hand in hand with that thought of like, how can I trust my body if my body's betrayed me? And so this can be a really challenging thing too. Like it makes sense. It's like a short term, but it's a really challenging thing to embody. But it's important for us to know that research tells us that psychological distress was most likely to be found in those who blamed themselves in some way. And so the opposite of trusting ourselves is essentially blaming ourselves for our situation, blaming ourselves for our diagnosis. So how do I trust and get to a place where I can trust myself, trust the decisions that I'm making, trust the direction that I'm going? The final two things, positivity, I'm going to go into a little bit more later, but positivity is a really, really powerful tool for emotional self-care. But positivity is one of those words that people kind of cringe at nowadays because there is the reality of toxic positivity that comes up. And the difference between positivity and toxic positivity is whenever you are not allowed to experience the negative or the challenging or the difficult emotions that go along with this journey. We all have probably been told things before like, well, at least you have the good kind of tumor, or at least you're not on real chemo, or at least like it's not malignant. Like we've all heard these different things before where it's essentially a response to our pain that says, you know what, you're not allowed to feel the hard stuff. Just be positive, be grateful for all the things that you do have and all of the good things that this does bring. Positivity is a really powerful tool. So I don't want positivity to get lost in all of the talk about toxic positivity these days. But positivity and really trying to have a positive outlook on our situation, on our lives, gratitude, these are all really, really powerful things as long as we know that it's just as important to experience and feel the difficult things. The final thing with emotional is this idea of paradox. We live in a society that tells us we need to pick one emotion over the other. We need to either be happy or sad. But the reality is, in most situations in life, we experience more than one emotion at the same time. And so really giving ourselves the permission, again, to not necessarily choose between all of the variety of emotions that we're feeling, but allowing just kind of the breadth of what we're feeling to exist. Okay, so spiritual self-care is going to look different for everybody. And some of these things may tie into if you practice a certain faith. Some of these things will also tie into if you don't practice a certain faith. And so the first thing is about cultivating hope. And hope it's the key to self-care. I mean, it's the key to resilience. It's the key to recovery. And hope sometimes can be a really difficult thing to find. And so cultivating and finding hope is a necessity, and cultivating hope is a choice. And so it's something that is active and that we have to actively do. Now, when we're talking about cultivating hope, there's 3 different actions that need to take place. The first one is, do we have the ability to set a goal for ourselves, an objective, something we want to work towards? And figuring out how we work towards that goal with the ability to be flexible. And so the research calls it a pathway. That pathway is, how do I get towards my goal? And the third thing is agency, which is essentially, I believe in myself enough to be able to move towards that goal. So can I see something for myself in the future? How do I move forward towards it? Or how can I figure out how to move towards it? And the belief in myself that I can do that. The second thing is gratitude. Gratitude is really significant too, but I have to say gratitude can sometimes take a place that's shame-based, where we tell ourselves, don't feel your negative emotions or don't feel the hard things because look at all of the things that you do have. Gratitude doesn't work if it's rooted in shame and shaming ourselves. And so when we're talking about gratitude, we need to look at it from the perspective of grateful for who we have, grateful for the circumstances in our life, but not as a way to criticize ourselves for having challenges or for struggling. Mindfulness meditation, again, is what we talked about in the last slide of like, how do we observe our lives and our thoughts and our feelings from a place of non-judgment? For those who do have spiritual or religious practices, mindfulness meditation might look like spending time and meditating on a certain scripture. For others, it might look like focusing and meditating and bringing your attention to your breath, like we talked about before. And the final one here is forgiveness. We could talk about forgiveness all night, and so I'm just touching on it briefly. But forgiveness is not only forgiveness for others, but forgiveness towards yourself or forgiveness towards your body for the things that have taken place. And again, forgiveness is a choice. All of these things in here are action-based. They're all choices that we can make. With taking care of ourselves socially, I think these are some of the most important pieces to keep in mind. When we're looking for a support system, especially if we've experienced something traumatic or something challenging, the research tells us that the most important factors are a support system that promotes like quietude, where you can have quiet, a sense of safety. I feel safe among these people to be myself, to express myself, to talk about the reality of my situation, and a feeling of being protected, that these people would step in and protect me if needed. Again, we just talked a little bit about toxic positivity, and I've got to say, with all of the clients that I meet with, toxic positivity comes up regularly because we live in a society that does not know how to handle grief and does not know how to handle pain. We live in a positivity society, and so anything that is hard or sad or challenging, we immediately try to run away from. And so many people receive comments like, at least it's not the bad kind, right? At least it's not that hard. At least you didn't lose your hair. All of these kinds of comments that really minimize our experience and can be really hurtful because they're telling us to just be positive or just be grateful. The toxic positivity piece is really rooted in our culture. It's rooted in a culture that really promotes that you should be happy all the time. And that's kind of it's a myth, like that's just not reality. And so it's really important whenever we're connecting with people and whenever we're developing a support system to understand that toxic positivity exists, but that people generally don't mean it negatively and generally aren't trying to minimize and dismiss our situations. For us to have grace, and I know that's hard sometimes, it's been hard in some of my situations too, but to have grace in regards to this need to always be positive and to maybe take a stance of educating people on what it's like to experience challenges or what it's like to have a desmoid tumor. Because sometimes those people who engage in toxic positivity or make toxically positive comments can be very supportive. They just don't know what to say. So it's really us assuming the best or mending relationships with people who have communicated to us in a way that is toxic positivity. In our world, it's very important for us to connect with other people, both other desmoid patients, but also people outside of the desmoid community. It's important for us not to root our whole identity in our diagnosis and to have those friendships and relationships outside of the desmoid community. But man, I gotta be honest with you, having people inside of the desmoid community is a game changer. I had an MRI today and I've sent text messages to like 4 or 5 of my desmoid friends because they get it. They know what today looks like for me. And so receiving encouragement from them today has been very different than receiving encouragement from people who haven't been through it before. Finally, boundaries is very important. And again, we could talk about this all night long. I'm just going to give a short little story. A couple of months ago, I was starting to spend some time with a new friend. And she is very kind, very interested, very invested, asks a lot of questions, wants to know what my experience is like. She invited me out to an event. And as soon as we get to that event, she says, Ashley, hang on a second, I'll be right back. About 15 minutes later, she comes back with event security, and they say that they've changed our seating arrangements because they just learned that I have cancer. And so this new friend went and told the event staff that I had cancer and asked for closer seats and more accommodations. Well, at first I felt very frustrated by this because I don't like people to use my situation in order to benefit or to gain from it. And I was about ready to say, you know what, I'm not going to spend time with this person anymore. They just don't get it. But instead, I decided, let me set a boundary, because if I'm clear about what I'm okay with, that's actually kind. If I'm unclear, that's unkind. And so if I just don't say anything and I disengage, that's unkind. And so let me at least try to set a boundary. This friend was very apologetic, completely understood, and has become one of my biggest supporters during this round of treatment, and has been very invested and very engaged. And so setting boundaries really has the potential of preserving our social relationships, versus when we think about boundaries, we tend to think about like constructing walls to keep people out. But in reality, we're really trying to preserve our relationships. These next two slides I'm going to go through really quickly because for the sake of time, I want to make sure we have time for questions. But in regards to intellectual self-care, these 4 things are very important. And the way that they show up in your life is going to be different for every single person. So how can we put ourselves in situations where we can learn something? How can we put ourselves in situations where we can solve problems, where we can be challenged? Now, this can happen in different areas of our life. This can happen at home. This can happen at work. This can happen by putting together a puzzle or playing a board game. But how do we incorporate learning, solving problems, and being challenged into our lives? The final thing on here is monitoring our self-talk. We've talked about the self-criticism before. And so from an intellectual point of view, it's important for us to investigate our thoughts, to be aware of our thoughts that come up so that we can monitor the negative self-talk and flip it and reframe it to be more compassionate, more kind to ourselves, and really engage in that shared humanity. The final thing about self-care is sensory self-care. This one I think is very, very important. And so how do I take care of all of my different senses? My sense of taste, what does that mean? What do I enjoy? What food do I enjoy? What beverages do I enjoy? And how can I incorporate that into my life in a way where I'm being intentional about enjoying them rather than indulging in them? My sense of smell might be things like aromatherapy. I like having essential oils going on throughout my house. My hearing, that might be, what music do I like? Do I like having music on whenever I'm home, whenever I'm driving? Let me create a playlist or do something that gets me exposed to music, because music really helps calm my nervous system or improve my mood. Tactile, things that I like to touch or things that I like to see. And whenever I see things, that might be like my environment, what's aesthetically pleasing to me, what do I like to look at, what colors do I like, having those types of things in my environment. Finally, all of these things in regards to self-care, they're all a commitment. And so I've said it throughout tonight. Self-care is a choice. Self-care is action. And so incorporating a lot of these things into your life, it's a decision that you're making to intentionally incorporate them into your life. But the key is incorporating them without shame, because often we're so used to putting things on our task list of like, I've got to do this today and this today and this today. And self-care becomes just another task. And if I don't do it, then I'm going to beat myself up for not doing it. And then it becomes just another way of shaming myself. And so we have to be really careful to commit to self-care, but not using shame as our motivator for making sure that we intentionally incorporate it into our lives. So I hope that you all have something that looks a little bit like this. It might look a little bit different, but in your self-care plan, there's a couple of different things that you've been able to identify and been able to record in order to begin to actively work on incorporating some of these different self-care strategies into your life. Now, these resources, I'm just going to leave this up for a second because a lot of these books were used to create this training specifically. I recommend all of them. I wish I only had a couple that were like the best, but I recommend all of them, especially whenever it comes to having different strategies to take care of yourself. This book, The Wisdom of Your Body, might be my top recommendation because it actually gives a lot of tools and a lot of strategies for how do I get back in touch with my body whenever that disconnection has happened, because of trauma, because of pain, because of discomfort, because of emotions I don't want to feel, all of those things. So I ran through the last two really fast, but I really want to open it up for questions. And so Lynn shared that in the little Q&A box, you can ask some questions. And over the next couple of minutes, hopefully I'll be able to answer some of them for you guys.
That's great. Thank you so much, Ashley. This was wonderful. I feel like every time you do another webinar, it becomes my new favorite. I feel like anybody could relate to this. And I thought it was great that it's pointed towards the desmoid tumor patient community. So we do have a couple questions, but I'm actually going to kick mine off first. So someone once told me that watching TV is not self-care. And it kind of makes sense to me, but I really don't get it. And I was wondering if you could pull that apart a little bit.
Yeah, I'm glad that you asked that because self-care is really all about intention and the intention behind it. And so is watching TV self-care? It could be, but if we're looking at it in regards to moderation versus something that's excessive, in regards to self-care, it would be looking at watching TV in moderation. Now, there are going to be certain things like the blue light is going to increase your cortisol levels. And so if you're watching TV right before bed and it impacts your sleep, maybe it's not the best self-care exercise. If you're watching TV to kind of numb yourself and escape from the emotions and the things that you're experiencing in your life, maybe that's not considered self-care. But if you're like really into a TV series right now and you're like just waiting for the next one and you have to know what happens and this TV show brings you joy and you're able to watch it for the enjoyment of the content versus watching it to escape from your outside life, then that would be considered self-care. Because this is something that's actually energizing me. It's actually filling me up. It might even be giving me content to go and talk to my closest friends and engage socially in a way where we all can talk about the TV series. And so intention is really the most important thing. We can't say for anything blanket, this is a self-care practice, because our intentions differ. And so if our intention is to escape from what's going on inside of our bodies, to escape from the outside world, then it would not be self-care. Does that clarify?
It does. It does make sense. It definitely clears things up for me. Thank you. So I know you said we were going to talk about 6 areas of self-care. Do you have any others that you could name?
Yeah, so there's a lot of others, and you can add this to your self-care list and your self-care plan. We talked about some of the most common or ones that we all experience in our life, but we might be looking at medical self-care, especially in our community. And so what does medical self-care look like? That might look like taking your medication or going to your doctor's offices or getting your scans on time or actually following your treatment plan. And so medical self-care is going to be one that's very important for our community. So I would encourage that being added to the list. There's professional self-care. How do we take care of ourselves at our job? Our work relationships are different than our friendships, but some of them might overlap and the way that we interact might be the same. And so there might need to be certain boundaries set at work with other people, but also with ourselves and how we engage in work and how much we push ourselves. There's financial self-care. How do we take care of our finances? How do we spend our money? Environmental, what does our environment look like? Recreational, how are we spending our time? What are the fun things that we're engaging in? Self-care in regards to our tasks and our responsibilities that we have to fulfill every day. And so there's a lot of different realms of self-care, and we can look at them all individually. There are some things that are going to cross over, but I would say those are some of the additional ones. Medical is really important for our community.
Okay, great. And lastly, how do you forgive your body?
Yeah, that's a loaded question. It's a big one. And in reality, for those in our community with desmoids, those that I've spoken to with cancer, chronic illness, rare disease, that piece of feeling betrayed by our body is a big one. And so how do we not even necessarily forgive ourselves, but forgive our body for the things that we have experienced, or that feeling of betrayal? Again, we could talk about it all night, but I think one of the most important pieces when it comes to forgiveness is developing empathy. And when we talk about forgiveness and extending forgiveness towards somebody else, one of the key components is developing empathy for the person who has hurt us. And so if that person is our body, how do we develop empathy for our body in the way that it's actually trying to protect us, or maybe even trying to heal us from the things that we're experiencing, you know? And so the education that we're doing is very, very important whenever we're talking about this concept of forgiving our body, because over the last couple of sessions, we've learned things like, you know what, your body actually maybe isn't fighting against you. Maybe all of these things you're experiencing and the reactions and the triggers and the anxiety and some of these uncomfortable things are actually our body's way of trying to protect us and trying to alert us to threats and trying to make sure that we're safe and we're well taken care of. And so if I can develop this sense of empathy towards my body and all of the things that it's trying to do and how hard it is working to actually take care of me and protect me and make sure my survival, then I can have a different perspective on how I relate to my body. And rather than seeing it as betraying me, is there something else that is coming into play that's affecting both of us? Because I am my body, I'm not separate from it. And so big question. We could talk about it for a very long time, but I would say that the first thing is, how do I really get to understand the fact that my body is working to protect me, and developing empathy for all of the things that it's trying to do versus looking at it from the perspective of how it's fighting against me. Yeah.
I really love that. Thank you. So I think that's all the questions that we have for now. Do you have anything else that you want to add before we close?
I don't. I just know I'm very thankful for the opportunity to do these and to speak to the Desmoid community. And with this one in particular, I think it's just such a pertinent topic to all of us, because self-care is really a proactive decision as we continue on this journey. And again, just how important it is to give ourselves the permission to practice self-care, knowing that it's not selfish, knowing that it's not indulgent, knowing that it's not, only for our benefit, but it's for our benefit so that we can go out and continue to actively engage in the world and in our relationships. And so hopefully some of this information was different than what you've heard typically with self-care. If you do like the spa, great, continue to do that. But hopefully there's some additional strategies to help in being proactive about caring for ourselves.
Okay, well said. Well said. Thank you so much,
Thank
Ashley, for
you.
addressing the topic of self-care today. I'm sure that, like you mentioned, I'm sure that everyone can relate. So we also thank the Desmoid tumor patient and care partner communities for joining us. Please note that we will be sharing a recording of this webinar after it's edited, in probably roughly like 2 weeks. All Dealing with Desmoids content can be found at dtrf.org/dealing with Desmoids. That's all one word, Dealing with Desmoids. Go to dtrf.org to subscribe to our mailing list so that you'll receive the notification of when the recording is available. Also, stay tuned. We will be hosting another Dealing with Desmoids webinar coming up in September. Actually, this is going to be a special one. And also make sure to join us for DTRF's Together We Will virtual weekend from September 23rd to the 25th. And you can learn more at our website, dtrf.org. I think that's it. Ashley, thank you so much again. We hope that everyone has a wonderful night or morning wherever you are. Thank you.